Good morning. Today is June 24th, 2020. Thank you so much for joining the Connect Care 3 webinar on navigating a new era of healthcare, which is part one of our Wellbeing webinar series. In response to COVID-19, Connect Care 3 will be offering a monthly webinar on the last Wednesday of every month that highlights the importance of your health and wellness, both physically and mentally. My name is Amanda Christel, and along with me is Jean Good. Jean and I are both nurses here at Connect Care 3, and we are so glad that you could join us for today's webinar. So getting right into it, the healthcare system was completely upended as a result of COVID-19, and as physician offices reopen and elective surgeries are getting rescheduled, things are undoubtedly going to look different. Today, we are going to highlight various changes to expect as we resume seeking medical care after a pandemic and best practices in caring for yourself to prevent future illness.
The Centers for Disease Control, or the CDC, says the best way to prevent COVID-19 is to avoid exposure. The recommendations from the CDC include staying at least 6 feet away from others and wearing a mask that covers your nose and mouth because the virus is suspected of being transmitted mainly through respiratory droplets. People can spread this virus even when they don't have symptoms, which is called asymptomatic spread. The CDC recommends that everyone wash his or her hands, often with soap and water, for at least 20 seconds. Cover your mouth and nose with a mask when around others, even if you aren't sick. Cover a cough and sneeze with an elbow, and clean and disinfect surfaces in your home daily. Staying away from others is especially important if you are in the group deemed to be the most vulnerable.
Jean, can you explain more about what it means to be most vulnerable?
Amanda, I'm glad you asked. The most vulnerable population includes those who are over 65 years of age, those living in long-term nursing facilities, or those of any age with underlying chronic disease, especially if they're not well controlled. This includes obesity with a BMI over 40, chronic lung disease or moderate to severe asthma, a serious heart condition, liver or chronic kidney disease requiring dialysis, or those people who are immunocompromised. Being immunocompromised can result from cancer treatment, medications, bone marrow transplants, and immune deficiencies. It's important that in these changing times to monitor your health very closely. According to Dr. Frieden, the former head of the CDC, and many other health experts, we all need to prepare for a new normal associated with the COVID-19 virus. Medical systems will need to strengthen their tracking of the virus for those who may have been exposed, which is called contact tracing. Contact tracing is used when a person has tested positive to determine who they have been in recent contact with. The contact tracer will ask questions of the person who has tested positive and will follow up with the individuals they may have been in contact with, merely saying they have been in recent contact with someone who tested positive for COVID-19. Self-quarantine will be suggested for those who have had recent contact with an individual who has tested positive. It has also been suggested that medical care for those with chronic disease may be switched to virtual or telemedicine visits, and prescriptions for stable patients could last for a longer period of time. Long-term care facilities and medical facilities need to incorporate more safety measures for everyone, including the most vulnerable we talked about before. COVID-19 and what we know about it is ever-changing. Medical systems and facilities have no history of how to manage the current pandemic because it is a novel virus, meaning it's a new virus. And as a result, many changes will be instituted over months to come. Processes will change, and you can anticipate additional changes will be made throughout the coming months and years as we wait for a vaccine to be developed that will help to stop the spread. Some of those changes might be waiting in your car for your appointment instead of a waiting room, wearing a mask to enter a medical building, having your temperature checked before your appointment, and screening calls to assess for symptoms prior to your appointment. Most medical offices and hospitals are limiting visitors at this time. If your significant other cannot attend the appointment with you, ask if you can put them on the phone to hear the appointment and to also ask questions during the appointment. You can stay up to date with your current information about the virus by visiting the CDC website. You can also stay up to date by contacting your primary care physician to learn about the changes that are being made in the way they practice as well.
Jean, what can you tell us about the current processes in place for elective surgery?
I'm glad you asked that, Amanda. I've had 2 patients recently that had surgery, and elective surgeries have resumed in many places. The schedule and process may rely heavily on the availability of PPE or personal protective equipment for the medical staff. For my patients, both had the experience that no visitors were allowed, which means they were dropped off at the door, and when one stayed overnight, no one could visit. One of them had to have a COVID-19 test prior and stayed home when it was negative and quarantined for 14 days leading up to the date of surgery. The other person was screened at the time of admission. It may take a while for elective surgeries to be rescheduled, as the scheduling of operating rooms is very difficult and cumbersome for most healthcare systems. Remember through all this to be flexible and patient. Changes will be made, and those changes will most likely be changed up again. Above all, ask how your doctor and medical facility are keeping you and their staff as safe as possible whenever you are scheduled for a visit, test, procedure, or surgery. As we practice social distancing to avoid exposure to the COVID-19 virus, telemedicine and/or virtual visits may provide a safe and efficient alternative to obtaining health care in person. Geisinger Health System in Pennsylvania recently reported they have gone from 40 virtual visits a day to between 4,000 and 5,000 virtual visits a day due to the COVID-19 virus. You can utilize telemedicine for non-emergency care as offered by your carrier. This type of non-emergency care can include a cough or cold, pink eye, skin issues or rashes, behavioral therapy, and/or counseling. Your primary care physician or specialist may also choose to hold visits via the computer or phone as well, typically called a virtual visit. To make your virtual visit more meaningful, you will want to prepare for that visit as you would for any other medical appointment. Write down the questions you want to ask, beginning with the most important. Take photos of issues that are concerning to you, like a new rash. Become familiar with the technology before the visit is to take place. Ask the provider if the visit is being done on a platform that supports confidentiality, and make sure you know which telemedicine platform your insurance carrier supports and covers for you and anyone on your plan. A virtual visit by your primary care physician or specialty physician is different than a telemedicine platform, such as on-demand care offered by companies like Dial-A-Doc or Amwell. Telemedicine is typically a once-and-done thing. However, a virtual visit with your primary care physician or specialist may be the way your physician has chosen to work with his or her patients in this time of social distancing. Call your primary care physician to ask if a virtual visit may be a way for you to have an appointment for routine care, especially if you are in the vulnerable group we discussed before. Make sure you know what fees are associated with the visit, including the usual copay. A telemedicine or virtual visit is also often suggested as the first step if you believe you may have the COVID-19 virus. We've included several questions you may want to ask during your virtual visit on the slide. One of the most important things to learn during your visit is what treatment recommendations or changes are being suggested, along with how you can help to make the treatment successful.
Jean, if I could just jump in here really quick, one thing to keep in mind is that our team of nurse navigators remains available to work with any employee or dependent covered under the medical plan that has a medical diagnosis. We would certainly be glad to help you prepare for any upcoming appointments that you may have.
So now let's talk about primary care physician or family doctor, or what is known as a PCP.
Jean, if I rarely ever get sick, why can't I just go to an urgent care instead of having a primary care physician?
Amanda, I'm happy you asked that question. According to the American Association of Family Physicians, primary care physicians devote the majority of their practice to providing primary care services to a defined population of patients. The style of primary care practice is such that the personal primary care physician serves as the entry point for substantially all of the patient's medical and health care needs, not limited by problem origin, organ system, or diagnosis. Primary care physicians are advocates for the patient in coordinating the use of the entire healthcare system to benefit the patient. In other words, a primary care physician is essential to help you maintain both good health and to stay healthy. A PCP can help identify risk factors that could be changed to help prevent disease, while they also coordinate and manage chronic disease to ensure a better quality of life. They get to know you and your health challenges throughout the years. Because a PCP is important in the management of your health, it is important to select one you will respect and work together with to maintain your health. Perhaps you don't have a PCP and want to know the best way to find one. We suggest that you talk to friends, family, and coworkers to determine their PCP and see if they feel their relationship and experiences with that physician are such that they would recommend him or her for you. You can also go to your carrier's website to obtain a list of primary care physician practices that are in your network close to your home or work. In addition, you will want to make an appointment with a new primary care physician to determine if their practice style meets both your physical and emotional needs. Making sure you're up to date on preventative services is one of the most important things you can do to stay healthy, says the Deputy Assistant Secretary for Health in the U.S. Department of Health and Human Services, otherwise known as HHS. HHS recommends 22 preventive services specifically for women's health. For men's health, there are approximately 10 recommended preventative services, while there are 26 for children. In the end, it's more cost-effective to take steps to prevent disease than to pay for treatment. We know that due to COVID-19, many screenings have been placed on hold. It is important to know what screenings are most important for you to have done based on your own personal risk factors. This is a conversation you will want to have with your PCP, and one of the reasons it's so important to have a personal physician. You will want to ask what screenings are needed to keep your health at its optimum while not exposing you to unnecessary risks. According to the Kaiser Family Foundation, as many as 48% of Americans say they or someone in their household have postponed or skipped medical care as a result of COVID-19. In addition, according to a recent study by Epic, they found there was an overall reduction of between 86 and 94% in cancer screenings due to COVID-19. This includes colon, breast, and cervical cancer screenings. This means there may be a delay in learning about a new cancer, and because of that, there is a delay in beginning treatment. If you and your PCP decide you need to have a screening, ask about the plans that are in place to keep you and the medical workers as safe as possible from the risks associated with the virus while undergoing the screening. Once again, it is important to know what your risk factors are and ask your PCP if you should have those screenings as hospital outpatient centers begin offering more in-person evaluations. Vaccines are also an important part of staying healthy for everyone, from the very young to the elderly. According to the CDC, the ongoing COVID-19 pandemic is a reminder of the importance of vaccination. They've identified recent declines in pediatric vaccines, especially in older children. This might indicate that U.S. children and their communities face increased risk for outbreaks of vaccine-preventable diseases in the future. If you are concerned about how your child's medical office plans to protect you and your child against the virus, call to ask. Many offices have specific times for well children and sick children, with intensive cleaning in between, while others have separate locations or waiting rooms for well versus sick visits. It is vital to the health of our children to protect them against serious vaccine-preventable diseases, even as the COVID-19 pandemic continues. This is important for adults as well. Many medical conditions increase the risk of severe disease from infections, including vaccine-preventable diseases. One of the most common is influenza. You will want to consider having the flu vaccine this year to help protect you from the yearly influenza illness. Vaccine recommendations are based not only on age, but also on medical conditions. Have a conversation with your PCP about the vaccines that are most important for you to have at this time.
So a rather unintended and unexpected finding related to the coronavirus is hospitals across the country have seen a sharp drop in emergency room visits, even for life-threatening conditions. Many people fear they will get the coronavirus if they go to the hospital, so they choose to stay home instead. Hospitals across the U.S. have implemented strict policies and safety precautions to prevent the transmission of the coronavirus. Many hospitals have created COVID units, meaning all patients who are positive for the coronavirus, and often even those who are suspected to be positive for COVID-19, are completely isolated from other patients and remain in their own area of the hospital. In addition to the symptoms included on this list, other reasons to go to the emergency room include traumatic injuries such as a broken bone or amputation, severe burns, head injuries, as well as mental health crises. Seconds count when seeking emergency care, and delaying treatment can ultimately result in a fatal outcome. Recent studies have suggested a spike in alcohol and drug abuse related to the pandemic, as more people are spending time at home, and as a result, there are less consequences associated with using. However, like other healthcare services, many mental health and substance abuse programs have also adapted and are using online platforms to make sure anyone can access these essential services. Whether it's a new diagnosis of anxiety or a recurring episode of depression made worse by social isolation, there are plenty of mental health services available to support you through these times. Furthermore, both inpatient and outpatient drug and alcohol facilities are still treating patients and are adapting to do so in a socially distanced way. When contacting these facilities, it may be helpful to request additional information about the current practices and policies they have in place as it relates to COVID-19, if that is something of concern to you. For those who are in active recovery, COVID-19 presents numerous challenges in maintaining sobriety, since many recovery programs include group meetings and connecting with others who are also in recovery. Remember that these adaptations are only temporary, and as our communities begin to reopen, traditional therapy and treatment options will resume. As they say on an airplane, you have to first apply your own oxygen mask before helping others around you. Taking the time to improve your current state of health is the best way to decrease your future risk of getting sick. This includes both mental and physical health. Remember that self-care is an essential and not a luxury. The foods we consume have a very strong connection to our overall health. Our diet should consist primarily of fresh fruits and vegetables and lean proteins. Minimize processed foods and sugar-sweetened beverages. Numerous vitamins, including vitamin D, zinc, and vitamin C, have been shown to boost our immune systems. Foods that are high in zinc include lentils, oatmeal, and low-fat yogurt. Foods that are high in vitamin D include fish, fortified milk, and fortified orange juice. Foods high in vitamin C include citrus fruits, broccoli, tomatoes, and leafy greens. Proceed with caution if you are considering purchasing an immune-boosting herbal supplement, as many of these supplements boast unfounded results. Intentional movement and physical activity helps both physical and mental health. Strive for at least 150 minutes of moderate activity per week and get your whole family involved. While going to the gym right now might not be an option, getting outside and going for a walk or a hike or even a bike ride or doing yard work around the house is a great starting place. Getting adequate sleep is essential to our overall wellness and has been shown to impact our immune system as well. While you sleep, your body is producing and releasing a protein called cytokines, which targets infection and inflammation. A lack of sleep also puts you at an increased risk for obesity, diabetes, and cardiovascular disease. Alcohol and tobacco use put you at a much higher risk for developing up to 18 different types of cancer. While we all know that completely staying away from alcohol or tobacco altogether is the most effective means of prevention, however, focusing on a harm reduction approach may be much more effective for those who are struggling with alcohol or tobacco use. Even if you cannot eliminate alcohol or tobacco entirely, Cutting back has still been shown to have positive health benefits and enables you to gradually work towards abstinence. Guidelines for alcohol intake include 1 drink per day for women and 2 drinks per day for men. Long-term stress that is poorly managed can affect your body's immune system, putting you at a greater risk for not only acute illness, but chronic diseases as well. Your body responds to stress by releasing hormones, including adrenaline and cortisol. In the short term, this fight or flight response will cause your heart rate and blood pressure to go up and increase your blood sugar, which may make you feel anxious or uneasy. If chronic stress occurs, these hormones can result in an increased risk for heart disease, weight gain, sleep disturbance, as well as issues with memory and the ability to concentrate. Now is the perfect time to take the important steps needed to improve your health literacy. Health literacy is defined as the ability to obtain, communicate, process, and understand basic health information to make appropriate healthcare decisions. One of the most important factors in health literacy is seeking information from credible sources. We are inundated every single day with information about COVID-19, whether it be on the news, on social media, or other online resources. If you are interested in reviewing information about COVID-19 or health information on really any topic, make sure you are doing your due diligence and reading information from a reputable source. Highly recommended resources include world-renowned institutions such as Johns Hopkins, the Cleveland Clinic, or the Mayo Clinic, in addition to the CDC or World Health Organization websites. Remember, essentially anyone can publish anything on the internet, so you cannot believe everything you read. Be sure to communicate with your physician on how you learn best. If drawings and diagrams are more helpful than just sitting and listening, let your physician know that. I think all of us have had the experience where we sit through a doctor's appointment and nod our heads in agreement as the doctor is talking to us, but as soon as we get out in the parking lot, we think of 10 questions we wish we would have asked. Don't hesitate to speak up during the appointment if you need clarification or additional information on something the doctor mentioned. That wraps up the content of our presentation today. To recap, the current CDC guidelines include continued social distancing, wearing masks, hand hygiene, and regularly disinfecting surfaces. Virtual visits and telemedicine are a safe and effective way to continue seeking medical care as hospitals and physician practices reopen. It will be important to clarify any costs, including normal copays, prior to the virtual appointment. Preventive care, including cancer screenings and vaccines, are still a highly important aspect of healthcare, and you should have a conversation with your provider regarding how and when you can safely proceed with these services. Mental health and substance abuse programs remain accessible to patients in need during these times. Supporting your mental health is just as important as your physical health. And lastly, taking care of your health needs now is a sure way to prevent future illness. Implementing small, sustainable, healthy lifestyle changes will certainly lead to positive outcomes. Thank you so much for taking the time out of your day to join our webinar. We hope you learned something new and will have a greater idea of what to expect when seeking medical care. If you have questions about today's presentation, are interested in learning more about the Connect Care 3 programs, or are an employee or dependent covered under the medical plan and would like to utilize one of Connect Care 3's clinical programs, here's our contact information. The Connect Care 3 team hopes you will be able to join us for our next Wellbeing webinar session, which will be held on Wednesday, July 29, 2020 at 10 a.m. The topic of this webinar will be mental well-being. Thanks again and have a great day.